So basically, there are two methods for doing hair transplants. One is the follicular unit extraction method, which is been available just since about the late 90s. It was started by a fellow in Australia, Ray Woods, and I started doing it in about 2003. I became curious and actually phoned Dr. Woods in 2003 and was able to sort of mimic what he was doing. And at the time, we were using about 1 millimeter punches. Punches we use now are quite a bit smaller. And for the first 5 or 6 years of doing this, we were using manual punches. At this time, we're now using power punches, which makes the procedure much faster, and much smaller punches as well. On the face, we can do not only head hair, but we can also take beard hair, body hair. Unfortunately, body hair doesn't grow that well on the head, so you tend to need a lot of head hairs to create the same effect as one beard or you need a lot of body hair to create the same effect as one beard or head hair. So it's more used in repair cases rather than for primary male pattern baldness. I can extract, I've been doing this for 10 years now, so I can extract up to a sort of 1,000 to 1,500 grafts per hour. The main advantages of this technique are there's no linear scar, no scalpel, no sutures, so you just end up with, you can buzz your head after even down to very close to the scalp, down to a quarter of an inch or less, or even down to the wood, and you wouldn't see any scarring in the back of your head. I've done as many as 4,000 grafts in a day, but I don't usually book more than about 3,000, and I can usually extract those in the period, even with breaks, in about 3 hours, and then it would take in the range of another hour to an hour and a half to make the sites, and then 4 to 6 hours to plant them. So we'd end up with about even a 10 or 12-hour procedure, which is quite a bit longer than a strip procedure. So the downside of the FUE is, number one, is it's a little bit more expensive because it's more labor intensive, as well as the fact that you have to shave your head. I quite often see guys in their sort of 40s or 50s, or really at any age, that really just it's not practical for them to shave their head because of their job, and they just prefer to have the strip procedure. The strip procedure, basically we take a strip, usually in the range of sort of 1.5 centimeters plus, right across the back, and depending on the number of grafts we want to get, it can be between sort of 10 centimeters and up to 35 centimeters from above one ear to above the other ear. The density of the hair on the back of the head varies from sort of 50 to 150 grafts per square centimeter, averaging sort of 80 to 100 grafts. So if you take out a strip that's, let's say, 1.5 times 20 centimeters, you'd have 30 square centimeters of scalp, so you'd get in the range of about 3,000 grafts. So are somewhere between sort of 2,500 to 3,000 in somebody with reasonable density. Now what we do is dissect the follicles into 1, 2, and 3, and 4 hair, just the way they appear in nature. Grafts in the back or follicular units just come out of one, so you'll get 1, 2, 3, or 4 hairs coming out of one hole. So we just dissect them the way they appear in the back, and we can do up to 5,000 grafts in a day. I've done as many as 5,000 in somebody with good density, and create a pretty good head of hair in one day in somebody that has good density and the hair is thick on the back of the head. This fellow, we've just done a 3,000 graft FUE procedure, so we've buzzed his head, and that just gives you an idea of what 3,000 grafts will do on the top of your head, and somebody with sort of average shaft diameter. So he doesn't have particularly thick hair, but it isn't, I mean, it's sort of average, so that would be sort of an average change that you could expect from 3,000 grafts. The recovery after FUE, the back of the head, one of the other nice things about FUE is that there's no pain afterwards, surprisingly, and after we started to do FUE, it was for the first time we had patients actually saying it hurt a bit in the recipient site, which you'd never hear with a strip procedure. So there's almost no discomfort, and people, now the downside again is that your head's buzzed, So somebody that's in a situation that has to sort of take a few weeks off to let their hair grow in a bit. Now the recipient site is identical, so usually takes about 10 days to heal. So you'll have crust on the top of your head for about 10 days, and the growth will start at about 10 to 12 weeks after. This is another patient. This patient, I think, had about a 3,500 graft strip procedure, and you can see he had decided that he wanted to keep his hair long. He didn't want to buzz his head, and we can create pretty good density after with just one sitting. He's got was pretty happy with this result. This is a female, obviously a female patient with some thinning at the front, which you quite often see in females, either generalized thinning or some receding in the front. And with one session, just putting in 1,500 grafts, you can create a pretty good hairline. Women don't very often, for obvious reasons, go for FUE just because it's not practical for them to buzz the back of their head, unless you're doing very small sessions. When we do eyebrows in females, we almost always use FUE just because there's less pain after. And usually with eyebrows, we're only needing 2 to 250 grafts per brow. So we would be able to do just buzz a little bit underneath the long hair in the back and take out FUE and plant them in the brow.